Hi, welcome to Ask Dr. Pelto this week. Today we're going to go over a few of the questions that we had in this last week, and I hope you find them interesting. So let's look here. We're going to look at a couple of the problems that came into the office and some of the questions that I got online. So let's jump right into it. Why did I get this ingrown nail? What we find is that a lot of patients now, they're not being able to see their provider for a number of months, and that causes problems. And this is one of the problems that we see here. This area right here is a little bit of pus by the side of the ingrown toenail. This was cleared up pretty easily in the office, but this is one of the whole problems that we're seeing now with COVID. Long nails infections where they would normally come in sooner. Next is a bad fitting brace question. So this is a patient that originally had a crow boot, and then he went to a patellar tendon bearing brace, and this area right down here caused a little bit of a blister, and then it caused something worse. There's two ways of making patellar tendon bearing braces, one that straps into the shoe and one that is a brace. This brace, though, with someone that's neuropathic can be a problem. This is what we found. Originally, it started with something like this. He went back into the crow, was adjusted, and then it turned into an infection right here, and he was getting some IV antibiotics. So you have to be real careful if you have Charcot, if you're being transitioned either to a crow boot or a patellar tendon bearing brace or any type of a brace, just that it doesn't cause any other problems that can be problematic. And then finally, this is the question that was sent on the page here on YouTube. Hi, I'm a runner. I've lost my toenail. It's very lumpy, and about a quarter of it towards the free edge has completely gone, and it's no longer attached. In comparison with my other big nail, it's very short. I'm very worried about it growing back properly. How do I know if it will or not, or reattach? It seems to look healthy down at my cuticle though. This is a kind of an example maybe of what your nail looks like here. If there's red down here, you're probably going to lose the whole toenail because the bleeding is everywhere. Same with this one. If it looks like this with a little bit better of a nail and it's lost this, and if it looks normal, it's probably going to grow out and reattach. But really, if the toenail is totally lifted and it's got some swelling at the base here, you're probably going to have the whole nail off. Normally, they grow back normal as long as you can avoid the trauma. So one good way is going to be an anatomic shoe, so a shoe with a lot of area in the front, Ultra, ALTRA type of a shoe, or a Topo tends to be a very good shoe for that. Is it going to grow out? It usually does. It could have some thickening to it or some other abnormalities. So that's kind of the answer to your question. I asked to send a picture. No picture was sent, but certainly I want to invite everyone here to ask your question at drpelto.com. There's a little thing you can just ask your question, send it, and I'd be happy to answer it on this next session of Ask Your Question. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.